Have you noticed subtle but worrying changes in someone you love over the past year? Many people believe that death in old age happens suddenly, but in reality, the body often gives quiet signals months or even a year before the end. Unfortunately, these signs are easy to overlook because they start out small. It's usually only in hindsight that families recognize the warning signs, but by then, it's often too late to fully prepare or make the most of the time left. In this video, we'll explore 5 important signs that may show up a year before an elderly person passes away. Some may seem like ordinary signs of aging, while others might appear minor but actually reflect the body's slow decline. Recognizing them early allows you to offer better care, create meaningful moments, and ensure your loved one's final stage is filled with comfort and dignity. Stay with us as we walk through these 5 signs, because understanding them now can help you face what's ahead with both emotional and practical readiness. When you know what to expect, you can be present, prepared, and make each remaining day count. Sign number 1, noticeable weight loss. One of the most common early indicators of approaching the final stage of life is unintentional weight loss. It may begin subtly: a looser belt, baggier clothes, or a declining appetite. Many people dismiss this as normal aging, but losing weight without trying is often a sign that the body isn't functioning as it should. It may signal poor nutrient absorption, muscle loss, or a slowdown of internal systems. While gradual muscle loss is part of aging, rapid decline points to more serious issues. The body may struggle to process food or protein, leading to weakness and greater risk of infections or falls. Appetite changes are also common. Food may lose its appeal, and meals get skipped more often. This isn't just personal preference. It's a physiological shift as the body starts to wind down. Medical issues like cancer, heart failure, kidney disease, or even depression and dementia can also cause weight loss long before other symptoms emerge. Families often try to counteract this with high-calorie foods or supplements, but if the weight continues to drop, it's important to see it as more than just a nutrition issue. It may be the body preparing for its final transition. Rather than pushing large meals, focusing on comfort, easy-to-eat foods, and staying hydrated can be more beneficial. If you see a loved one growing thinner, weaker, or less active, take it seriously. It's not just about how they look, it's a sign from the body. Recognizing this can help you offer support with clarity, compassion, and the chance to make the most of the time you have left. Sign number 2, persistent fatigue and weakness. A major change often seen in the year leading up to the end of life is a deep, ongoing fatigue that doesn't go away with rest. This isn't just the usual tiredness after a long day. It's an overwhelming exhaustion that makes even the simplest tasks feel like a struggle. Getting out of bed, walking across a room, or doing daily routines like getting dressed or having a conversation can become too much. This level of fatigue isn't just part of normal aging. It's a sign that the body is slowing down and starting to conserve energy. As organs begin to function less efficiently, the heart pumps less powerfully, blood flow weakens, and muscles receive less oxygen, all of which lead to a noticeable decline in strength and stamina. Another reason is the slowing metabolism. The body starts using energy differently, shifting focus from activity to preservation. As a result, your loved one might begin sleeping more, needing longer naps, or having trouble staying awake during the day. Energy crashes can come suddenly. They may seem okay one moment and completely drain the next. Emotionally, this exhaustion can be just as hard. Many seniors feel frustrated or embarrassed that they can't do what they once could. They may pull back from conversations or activities, not because they don't care, but because they simply don't have the energy. This can lead to isolation, which often speeds up the decline. Watching this happen can be heartbreaking. It's easy to misinterpret their fatigue as laziness, but trying to push them to do more often backfires. What's more helpful is honoring their limits, supporting rest, and focusing on comfort. If your loved one seems constantly tired and weaker than before, it may be a sign that their body's moving into a new phase. This is the moment to slow down with them, have gentle conversations, and create a peaceful space filled with compassion and care. Sign number 3, mental confusion and emotional withdrawal. As someone nears the final stage of life, changes in thinking, memory, and emotional connection often become more noticeable. A person who once seemed sharp and alert may begin to forget things frequently, lose track of conversations, or appear confused in familiar settings. They might repeat themselves, forget names, or be unsure of the time, even if they've never had cognitive issues before. These changes often begin quietly, sometimes even a year before death, and they go beyond ordinary forgetfulness. The brain, like any other organ, needs oxygen and nutrients to function well. As circulation declines and the brain receives less oxygen, cognitive ability starts to fade. This may show up as difficulty making decisions, recognizing familiar people or places, or fluctuating between moments of clarity and confusion. Emotionally, you might notice your loved one becoming more withdrawn. They may talk less, stop engaging in conversations, or prefer sitting quietly for long periods. It's not that they don't care anymore, it's that the brain is processing things differently now, and socializing can feel overwhelming. Mood and behavior can also shift. Some individuals become anxious or easily irritated, while others seem unusually calm or detached. These aren't personality changes. They're signs of the brain adjusting as the body slows down. For families, this phase can be one of the most painful. It may feel like your loved one is slipping away emotionally before they're physically gone, but it's important to remember they're not doing this on purpose. The best thing you can do is meet them with patience, speak gently, and offer comfort through your presence, even if they can't always respond. If you notice confusion, forgetfulness, or social withdrawal in someone you love, don't brush it off. These are signs that the body and mind are preparing for the final stage. This is the time to slow down, embrace quiet connection, and create a space of calm and familiarity, because even when words are lost, love still speaks. If this resonates with you, drop number 4 in the comments so I know you're still here, and be sure to subscribe so you don't miss what's coming up next. Sign number 4, repeated infections and slower healing. As a person nears the end of life, one clear indicator is a weakened immune system. Someone who rarely got sick before may now seem to catch every cold or flu going around, and what used to be minor illnesses take much longer to recover from. Cuts, scrapes, or bruises may heal slowly, and small infections can become persistent problems. This happens because the body is losing its ability to repair and protect itself. Common infections like pneumonia, urinary tract infections, UTIs, skin issues, or even gum problems can occur more often and take longer to resolve. Medications like antibiotics may become less effective, and recovery periods stretch out. Poor circulation also plays a role. When blood flow slows, oxygen and nutrients can't reach the tissues efficiently, making healing slower. Pressure sores or chronic wounds, especially in those who are less mobile, can develop more easily and become serious if not closely managed. Infections in older adults often don't present the way we expect. Instead of a fever, they might seem more tired, confused, or uninterested in eating. These subtle signs can be easy to miss, but they may actually be the body's early warnings of trouble. While it's natural to want to treat every infection aggressively, there comes a point where comfort becomes more important than cure. Gentle care, hydration, keeping skin clean and moisturized, and reducing physical strain can go a long way in helping someone feel better in their final stage of life. Sign number 5, changes in breathing and circulation. One of the clearest signs that the body is nearing its final phase is a shift in breathing patterns and circulation. Breathing may become slower, more shallow, or irregular. You might notice long pauses between breaths or episodes of rapid breathing, followed by silence, known as Cheney-Stokes respiration. Alongside these changes, circulation weakens. Hands, feet, and even the nose or ears may feel cold and appear pale or bluish. This happens because the body is directing blood to vital organs, reducing flow to the extremities. Shortness of breath can become more common, even during simple tasks like sitting up or talking. You may see them breathing more through their mouth or needing to pause often to catch their breath. Fluid buildup in the lungs might cause coughing, gurgling sounds, or a feeling of tightness in the chest. These symptoms are not just signs of a cold or flu, they're the body's way of winding down. Lying flat may become uncomfortable, and many find relief by sleeping propped up with pillows or in a recliner. Witnessing these changes can be scary, but they're often part of a natural process. Rather than trying to fix what's happening, focus on keeping your loved one comfortable. Small things like using a humidifier, keeping the room cool, or offering sips of water can make a big difference. In some cases, medications or oxygen therapy can ease discomfort. When you notice these signs, labored breathing, cold extremities, or a bluish tint, it's a signal that the body's entering its final stage. This is a time to offer calm, presence, and peace, not panic. Being there, offering a hand to hold, and speaking gently can mean more than anything else. Final thoughts. Recognizing the journey. To recap the 5 signs we've covered: significant weight loss, extreme fatigue, cognitive decline, frequent infections, and changes in breathing and circulation are often present in the final year of life. They might not appear all at once, and some may be subtle at first, but together they signal that the body is preparing for its final chapter. It's completely normal to want to fight against these changes, to encourage your loved one to eat more, walk more, or get back to normal. But sometimes the kindest thing we can do is listen to what their body is saying. This is a time to shift from trying to prolong life to making what time remains as rich and peaceful as possible. Recognizing these signs isn't about giving up. It's about being prepared. It gives you the chance to make thoughtful decisions, spend meaningful time together, and ensure that your loved one's final days are filled with comfort, dignity, and love. If you're seeing these changes in someone you care about, know that you're not alone. Many families have walked this path. While it's never easy, understanding what's happening can give you the strength and peace to walk it with compassion. Thank you for taking the time to be here. If this message resonated with you, we'd love to hear your thoughts. Feel free to share something you learned or how you plan to support your loved ones during this stage of life. Your words help inspire and connect others on this journey.